We're having a bit of a late start this morning. We're having a bit of a late start this morning, so we'll have a bit of a shortened version of the show this morning. However, and I would like to apologize for that for various reasons, which I will not go into, but I would like to apologize for that. Thank you so much to our regular listeners for tuning in, as always. And to our new listeners, it's always a pleasure having you with us. Last week, we were unable to bring you the program, but the week before, for those of you who have been listening, you know that we spoke about World Cancer Day. And this month, we really wanted to focus on cancer. It has been a bit challenging to get some of the guests that we would have liked to have on the program. However, this morning, we are going to have a little conversation. Well, not really a conversation. I will be sharing some information with you as it relates to the changes that happen with patients and also caregivers when there's a diagnosis of cancer. It is something that comes upon us quite suddenly sometimes, and many of us may not be aware of some of the feelings, the emotions that are involved. So, the information that I'm going to be sharing with you today comes from my readings and also from having conversations with various people who have been affected by cancer in one way or the other. So let us begin with the patient or the individual, the person who gets a diagnosis of cancer. If you remember, for those of you who are regular listeners, if you remember on that first show of February, we spoke about the unique experience of cancer patients. So the experiences for each patient would be different. The experiences for each caregiver would be different. However, there are some issues that most, if not all, face to a certain extent to varying degrees. And we're going to talk a little bit about the emotional experience of a patient. And when you listen to the patient stories, you may find that each one would express those emotions in having experienced those emotions in slightly different ways, or some not at all. Some of the common emotional reactions to a cancer diagnosis, and there are no wrong or right emotions. There's no one way that a person must feel when they get such a diagnosis. We know that it is a um, life-changing experience for both the patient and their circle. So their family, their friends, their supporters, their caregivers. One of the first things for many people might be shock and disbelief. Why? Because very often, if cancer is detected very early, maybe the symptoms, if any, there may not have been any symptoms that the person thought were so very serious as cancer, or they just felt that it couldn't possibly be. How could it be cancer? Shock and disbelief may be one of the first reactions to a diagnosis. The person may feel numb. The person may not even be able to process. You sometimes hear people talking about they received a diagnosis and they heard cancer, and after that they don't remember anything that the health professional, the healthcare provider said to them, because the cancer was just at the forefront of their minds. They could not process anything else. And it often takes some time for people to get used to the fact that they have this condition. If they have not been feeling too sick, it would be really, really a big shock to them. Sometimes, on first hearing about it, the person may not even want to repeat the diagnosis to anybody. They may keep it to themselves. They may keep it private. Sometimes we say, "Munka se we maladio," but sometimes it really is that people just need some time to process the the reality, to process the emotions that they are going through. Apart from shock, apart from the disbelief, really, I really have that condition, there is the fear and the anxiety. Fear of many things. Fear of losing their life, fear that they may not be able to afford the necessary treatment at the right time, fear of the changes that will happen within their families, fear that they may not be able to achieve the goals that they had set for their lives. So, all of this would be, it's possible that all of this could be going through a person's mind. And it really takes time for people to settle and accept, yes, I have the condition, I have it, and I am going to take certain steps. Not everybody can jump right into taking the necessary steps. For some people, it takes quite a while. Some people avoid speaking about it, they avoid anything that has to do with it. They don't want to know. Sometimes it goes as far as they may have a suspicion, but they don't want the healthcare provider to actually say to them, "You have cancer." They avoid talking about it, they avoid knowing anything about the condition. So they may be told, okay, you have this type of cancer, but they may not want to know what stage it's at. They may not be ready at that point to speak about treatment options. They may not be ready to have a conversation, not even with the people who are closest to them. And sometimes when patients hear or are given that diagnosis, they start to think that maybe, that people might be avoiding them, in as much as they would have avoided knowing about the condition, knowing about the different treatments and so on. They could also feel that their family and friends are avoiding them or not wanting to talk to them, because sometimes we just really don't know how a person is processing that information, it's processing what has been said to them. There's also the possibility of a patient experiencing anger, guilt. People may start to think and wonder, how did I contribute to getting that diagnosis? Is there something I could have done differently? Is there something I should have done differently? Could I have avoided that if I had done certain things, if I had eaten a certain way, if I had exercised? But really and truly, when we do know that there are several risk factors for various types of cancer, but we usually you cannot really pinpoint exactly why this particular person may have the condition. They may wonder why them and not somebody else. And that might be true, particularly for people who live very healthy lifestyles. But as we know, with cancer, there are modifiable risk factors and non-modifiable. There are things we have control over as it relates to lifestyle. So there are things that we have control over in terms of our diet, our level of exercise, whether we smoke, our body mass index, our weight management, and so on. However, there are also factors that we have no control over. And when you have that combination, it could very well be that that person could not have done anything significant, more significant than what they had already been doing to lower their modifiable risk factors, or the risk factors that they actually have some control over. So people may feel angry, people may start to wonder, think back, and blame themselves. And people may also feel isolated. Isolated in what way? At various points, I mean, from diagnosis to treatment to recovery and so on, that person may feel alone, isolated. They feel that maybe nobody can really understand what they're going through. And it can be a very lonely place. You're surrounded by people, but you feel alone. You may feel that people are there for you, maybe in a physical way, they are there, but they cannot really understand that I am going through these things. I am thinking of so many things. I can see my life. Basically, as we say, we see our lives flashing before our eyes. We have so many fears. We have so much anxiety. Sometimes people may feel that they are not heard, that people are not listening to them. You know, sometimes we expect people to just get on with it. Okay, you got the diagnosis, so now it's time to do this and do that. And it takes time. For some people, it takes longer than others to actually get to that point where they can think about what is the next step. How will I manage? They may feel guilty for, having certain thoughts, for expressing certain thoughts. Sometimes when people are going through a difficult time, we say to them, oh, just be strong. Just be strong. Or for those of us who are religious, we tell them to pray, to lean on God, to be faithful. And sometimes that may not be what the person needs to hear at that point in time. It may not even be so helpful at that point in time. Maybe that person may just need you to listen and say nothing, to just listen, allow them to express themselves, to talk about everything when they feel like talking, to talk about everything, whether it is as we may interpret it as negative, having negative thoughts, or whether it's positive. Sometimes we expect people to just be jovial all the time and happy and thankful and grateful that they are still alive. However, in being alive, they are dealing with a lot of other issues that make them anxious, that may cause them to be sad, to become depressed. Some people may feel numb, and that numbness can last for a long time with some people. And because people are going through so many things, the uncertainty, what is going to happen next? Will I make it? How will my children deal with it? How will my spouse deal with it? They think about, the financial stress. They may feel resentment towards others, people that they see out there who are happy and laughing and living life to the fullest. And as a family member, you may fall within that category, that you may be resented just because you live in your life. Sometimes the patient may be making comparisons between their lifestyle and the lifestyle of somebody else in their circle who probably does the worst, as we would say. The person smokes, the person drinks excessively, they drink too much, they smoke, they don't eat healthily, and that person is out there enjoying life while they are they have to deal with that condition, have to deal with cancer, a diagnosis of cancer. They could become also frustrated. There are a lot of different emotions that are associated with a diagnosis of cancer, and it is not always easy to move past those emotions through diagnosis, through treatment, through being in remission. And how a person deals with a diagnosis of cancer may depend on many things. The age might be a factor. So, for example, somebody who has lived a full life and gets a diagnosis at probably age 75 or above, that person may be more accepting. That person would probably have already started to think of the transition from life into death, and they may feel like, I've lived a full life. I've seen my children grow, I've seen my grandchildren, I have accomplished so many of the goals that I set out for my life. That person may be more accepting, not necessarily so, but it may be. So somebody who is younger, and when we are young, we always feel that we have so much more life ahead of us, that tomorrow and so many more tomorrows are promised to us. We just take it for granted that we will be there for a very long time. And if a young person were to get a diagnosis of cancer, it may be much more difficult for them to process, a lot more difficult for them to accept. For men and for women, they may deal with it differently. So, for example, you may find that probably men might not be so willing to speak about it. Some studies suggest that women become depressed a lot more than men with a cancer diagnosis. So the sex, male or female, may influence as well how a person deals with a diagnosis of cancer and what effect it may have on them emotionally. The stage at which the diagnosis is made could could influence how a person feels, their emotions, the level of distress or psychological distress. So, for example, if a person has a very is if the cancer is detected very early, at a very early stage, we always say that early detection is key, is the best in terms of having a good survival chance, especially depending on the type of cancer. There are some cancers that are a little more aggressive than others, but in most cases, you would hear health professionals say that early detection is key. which means that if it is detected early, the chances of survival would likely be higher. So if a person is diagnosed at an early stage as opposed to a much later stage, then that would affect their emotions as well. And we're talking about emotions and what they're going through because it affects how they deal with those around other people around them. It affects the way they approach their treatment and all of that. The support that a person has can also influence their emotions. Somebody who has very little support would have a lot more to deal with than a person who has a wider social support network. So all of these things influence the how people feel, the emotions, and how they deal with a cancer diagnosis on a psychological level. With those emotions, usually, if a person has a support network, sometimes talking might help, being open, being honest. But in order for it to be beneficial, the caregiver, and we'll talk a little bit more about the caregiver in a little while, the caregiver needs to understand that an individual with a cancer diagnosis may go through all of those emotions. And it is also important to know how to help them, and also the caregiver has to take care of themselves. So, when we talk about caregivers, caregivers are usually people who are close to the patient. So, it could be a spouse, it could be a parent, it could be a sibling, a brother, a sister, their child, a relative. You know, when we get those diagnoses within a family or within a friend group, usually it would be somebody within that group, at least one person within that group who would step up and take on the responsibility of being a caregiver. Now, if we as individuals who are going to be caregivers have never been through, who have never had cancer, have never had to support somebody with cancer, we may be very unsure of exactly what we're supposed to do. We may walk on eggshells. We may not know whether to speak to the person about it or not. So a good guideline is usually to just follow the lead of the patient. So you go with, if the person is willing to speak, then you should be a good and active listener. And if the person is not yet ready to speak, we need to be patient and give them time. You may not know how to speak to the person. And as we spoke about the emotions that a patient may be going through. Now, it does not mean that it happens, all of it would happen step by step. So you go from one emotion to the next, and that's it, like a line in the sand. These emotions can change at any time. The person could be having a lively conversation, and then you happen to say something and the person erupts in tears or anger. It is a very tricky situation, a sensitive situation, and we all learn through the process. As a caregiver, as you continue to provide support for that patient, you will get to learn how to deal with that particular patient, and it requires patience. We cannot be too demanding in terms of how we want the patient to behave. So, for example, but you have so many people there for you. You have everything you need. Why are you behaving like that? You need to be thankful. You need to be grateful. That is not really how we should be dealing with that. So, as we said, every person's experience of the condition is different. So, the caregivers experience would also be a unique experience, and it would be based on many factors, including the patient's emotional the patient's emotions, the caregiver's personality, the caregiver's other responsibilities. The finances are always a big issue. But as a caregiver, we need to know that in as much as we have our own emotions, we need to try not to take anything too personally. So the person may be lashing out at some point in time, and in as much as probably we would want to lash out or return fire for fire, we need to be a little bit more subdued, try to find our calm, and so on. So, in what ways, what is a caregiver expected to do? What type of support is needed? Sometimes a patient may have more than one caregiver. You may have a whole load of caregivers with different responsibilities. And some of the responsibilities could include things like preparing meals, making appointments, taking the person to their appointments, being present during appointments with their doctor. And it can cause disruption. All of those things can cause disruption in the caregiver's daily routines. That person may need to take time from work. The person may have to change the way that they do things on a daily basis. The caregiver themselves may need to ask for help with some of their responsibilities in order that they can help the patient who has that diagnosis. You may need to help with chores, with errands, with paying bills, taking children to school, and all of those things, going to the bank, doing so many things that that person would have done for themselves, and the person may be unable to do for themselves at that point in time. Caregivers themselves also have emotions that are attached to the cancer diagnosis, because if you think about it, when we talk about caregivers, and as I said, usually they are family members, they are close friends. So the fact that your friend, your family member has received that diagnosis, you are also trying to process that diagnosis. You also have your own fears and anxieties surrounding the diagnosis. And at the same time, you are trying to provide the necessary support to that person. So it really is a, a difficult situation for both the patient and the caregiver. And we need to be aware of that. The caregiver the caregiver has so many responsibilities. The caregiver also has to deal with the patient's emotions, their own emotions, and it's a lot. And in our communities, you often hear people say that caregivers sometimes end up with so much stress and being getting sick because they are taking care of others and forgetting to take care of themselves, because they're under a lot of stress, under a lot of pressure. They're doing a lot for the person who has that condition, and they forget to take care of themselves. So you may find that the caregiver may forget to eat or may eat too little. The caregiver may have certain health conditions that just become worse because of all the stress that they are under. So, say for example, that person, um, let's use the most common, the diabetes and hypertension. Can you imagine a caregiver under so much stress and with diabetes and hypertension, and forgetting to take their medication, not sleeping enough, not eating how they probably should be eating, so they eat whatever they get whenever, not drinking enough water? You can imagine that, for example, the blood pressure would go up, the blood sugar would be out of control, and that could lead to further complications for the caregiver. So it is important for caregivers to also take care of themselves. Now, when we face those situations, there's an expectation sometimes that everybody will just be willing to help. Very often, you find that the majority of the responsibility falls on one person. You may find that some people may not be willing to help or not able to help for various reasons. Some people may not feel comfortable providing support to somebody with a diagnosis of cancer because of the fear of probably seeing that person sick. Some people that you expect to be caregivers may also have their own problems to deal with, whether they are the health issues, financial issues, marital issues, work related issues, and those stresses in their lives don't allow them to function well enough to deal with the added responsibility of taking care of somebody who has that diagnosis. Some people may just not have enough time. Some people may have had a bad experience of dealing with somebody, a close family member or friend who has been ill and probably not survived the illness. And some people just believe that if somebody is struggling, they don't want to be too close to somebody who's struggling. And sometimes it could be as simple as people see a caregiver taking care of somebody and they think, wow, he or she is doing such a great job. And they may not realize that you actually need help. They may believe that you have everything under control and you don't need help. So it is also the caregiver's responsibility. If you find that it is too much for you, it is taking a toll on you, you need to ask for help. Sometimes people don't realize that you need help because you seem to be doing such an excellent job, and you may be struggling under all of those responsibilities. So, in as much as ideally it would be best for people to offer to help you, you may also need to ask for help when you need help. So, we need to remember that both patient and caregiver are going through a lot emotionally. Emotionally, they go through a lot, whether it has to do with the actual illness, whether it has to do with financing treatment. We know that is a big issue. That is a very big issue here. Financing treatment for when somebody has been diagnosed with cancer. So, apart from the caregiver, we always talk about providing support. What support can you give? I've mentioned a few things that you can do, certain responsibilities that you can take on, even though you are not the full-time caregiver. You may help, you may support in certain ways. Simple ways: running a few errands, doing the groceries, picking up children from school, without actually taking on the full responsibility of being, you know, in the house, taking on all of the on-site responsibilities of the patient. Financially, we may not be able to give a large sum of money, but sometimes you may have, so for example, you have extra food that you planted around your house. You have extra lettuce, extra tomatoes, extra vegetables, you have some fruits, you have something that you know the person may like, the person, the family, the caregiver, because when you are in that situation, finances are tight. So even that could be of help to those who are in the process of dealing with a cancer diagnosis. For the caregiver, in order to continue, for the main caregivers, in order to continue to provide the necessary support to the patient, you need to take care of yourselves. You need to take a little time to relax, to do things that you like to do, whether it's half an hour of reading, whether it is a visit to a walk on the beach once a month. Don't forget to take some time for yourself. It could be 5 minutes. Some people like just a little 5 minutes alone with nobody speaking to them, no television, no phone, nothing. And always remember that it is important to understand the feelings, understand that the person is going through a lot emotionally, and to try not to take those emotions too personally. It is a very difficult, I can imagine. I have never been the caregiver of a person who has been diagnosed with cancer, but when you listen to others, you read others' stories, we can get a sense of what it is like. So I just want to encourage all caregivers out there to continue to do your best. For those who are within the circle, to provide whatever support you can in whatever way that you can, no matter how big or how small, it all in the end helps to make the process a little bit better. So thank you for tuning in to Casualty 911 on 88.5 Super FM this Monday morning. Next week, unfortunately, we will be unable to bring you the program because we have a clash with something. But the week after next, we look forward to you joining us on the program. So that would be March. The year is moving quite quickly, and we hope that you will join us on the program, not next week, but the week after next. And to all of you out there who are dealing with difficult situations, I encourage you to take it step by step and lean on those who are willing to allow you to lean on them. Thanks again for tuning in.